Bendigo TAFE's virtual open day. Today, the webinar we're presenting is What a Career in Nursing is Really Like, a candid chat with a nurse. My name is Jodie Skinner and my role at TAFE is the Industry Placement Coordinator for the health portfolio. So essentially my job is to liaise with industry, locate placements and allocate them to students accordingly. Joining me today is Michelle Primmer. Would you like to tell us a bit about yourself and your role here at TAFE, Michelle?
Sure. Hi everyone. So as Jodie just said, my name is Michelle. I'm a nursing educator at Bendigo TAFE. I have been for a few years now. I'm also currently a nurse. I'm a clinical nurse specialist in intensive care in Bendigo. So I'm doing both. I'm doing a couple of days a week at the TAFE and a couple of days a week at the hospital. So yeah.
Great, thanks Michelle. Okay, so the course we're focused on today is Diploma of Nursing. It is 24 months full time and we refer it, we say 24 months basically instead of 2 years because it does depend greatly on the practical placement component attached to each of your units of competency as you study. It's currently online 3 days per week plus on-campus practical assessments, and we are hoping to return to face-to-face learning in the future. However, this is subject to government guidelines. Some of the other courses available in the health portfolio are Health Services Assistant, Individual Support for Aged Care, Pathology Collection and Allied Health Assistance. Before we get started, I'd like to go through some housekeeping rules. We won't be using the hand function during this presentation. You'll have the opportunity to ask questions throughout the presentation in the chat. Some of them will be answered throughout the presentation and some will be answered at the end. And also please consider other people's privacy and use respectful language and behaviour and be respectful of other people's opinions and beliefs. Okay, so let's get started. Michelle, what helped you decide to begin a career in nursing?
Okay, so I've been nursing for a long time, so almost going into 20 years now. So my decision happened when I was 10 years old. Actually, I had a month-long stay at the Royal Children's after having an accident. During that time, obviously I was cared for by nurses every day. They'd be doing all of the things that I couldn't do myself because of my accident. And then also every day I still had to go to school. So I was seen by the teachers every day and had to do all of that work. So from a small country town, I decided that I wanted to be a nurse. So after finishing school, I applied for nursing and teaching in Bendigo, nursing and teaching in a few other larger cities. Got into nursing, which as I said, I've been doing for 20 years and now I'm teaching nursing. So win-win, got best of both worlds. So yeah, it's something I've always sort of wanted to do from a very young age and still very passionate about it.
Great, thanks Michelle. What are some of the benefits of becoming a nurse?
So as I've just come off night shift myself, I'm going to say that the biggest benefit is being able to do shift work. So shift work is great. You get to fit your life in around your work. So lots of different hours that you can actually work. So if you're not a morning person, you can do evening shifts. If you're not an evening person, you can do morning shifts. So it's very flexible in the different types of shifts you can actually do. So if you've got small children, it sort of works in that maybe you could do night shift or weekends if you're sort of trying to juggle things. One of the other biggest benefit I think of becoming a nurse is that you can work anywhere, you can do anything. So many different areas of nursing, so many different fields that you can go into. You can nurse anywhere within the world. So lots of different options that you can actually do. So yeah.
That's great. It sounds pretty flexible, family friendly to a degree. Okay, so
to a degree.
What are some of the things they don't tell you about?
So some of the things they don't tell you about. So I think if you had have asked me when I decided to start becoming a nurse, I wouldn't think that speaking about bodily functions would become a normal conversation at the tea table of, you know, you get a group of nurses and the things we're sort of talking about are not things that everybody else would talk about. So lots of normality over all of those different functions. So yeah, I think that's probably the biggest thing that they didn't sort of tell us how our life would change.
That's actually hilarious. What's your most memorable experience?
So I think over the years, I've had many memorable experiences. Every day I go to work, I am faced with different things that are happening, good and bad things. I think the most memorable things for me is that I'm there for the patients. I'm there as a caring support person in their most vulnerable times. I'm there for family, friends, loved ones during vulnerable times for them when their loved ones are in hospital. So I think being able to make a difference, big or small, in somebody's lives through the good and the bad, I think is the most memorable and rewarding part for me of being a nurse.
Thanks, Michelle. I can imagine also working in intensive care, that would have its highs and lows as well, lots of peaks and valleys.
It definitely does. So yeah, look, some days are more challenging than others, but yeah, you come out with knowing that you've tried your best for people when they're that unwell.
Yeah, thank you. What are the suitable personality traits and attributes to becoming a nurse?
So I think one of the definitely need to be caring and compassionate. As I just said, looking after people at their most vulnerable, looking after people when they're sort of coming into hospital, and having that nurse being a caring, compassionate person that can kind of understand what they're going through and assist them through that is definitely a attribute. Obviously being friendly, having a kind nature and being a people person. So good communication skills, being able to chat to your patients. And I think the most suitable attribute would have to be being flexible. So anything can happen at any, like you might be doing one thing and then it all changes. And especially with me in ICU, you never know what's around the corner. So having to be flexible and being able to change at any minute and, you know, go and deal with this patient and then this patient, and yeah, time management and flexibility, I think.
Great, thank you. With time management and flexibility, and also never knowing what's going to happen, the question I think on some people's lips will be, how has COVID changed or impacted your career so far?
Yes, so look, it's definitely been challenging. There's been a lot of challenges throughout all of this. I think the biggest challenge for us as nurses was anxiety and not sort of knowing what was going to happen. It is a worldwide pandemic. However, we deal with infectious patients all the time. We deal with patients that have got other infectious communicable viruses. We are taught the highest standards of PPE, so personal protective equipment, ensuring that we're washing our hands, wearing gloves, gowns, aprons, not transferring those things into the communities and not bringing those things home. So we've always had that all the time. So that's not something that had to change. That's the same, making sure that we are safe and that our other patients and the patients with COVID are safe. So I guess that side wasn't really challenging for us. The biggest challenge that I feel COVID has brought upon me as a nurse in the hospital is having restrictions. So restrictions of visitors being able to come in, the restrictions of loved ones being able to come and sit with their family. Fortunately, we've adapted. We've changed. Nursing is an ever-changing career, so we will often FaceTime family or video calls or video chats, or making sure that they've still got that connection to actually see them. I've sent photos to families' loved ones just so that they can actually see that they're there, they're being well looked after. It's just, it is hard when you can't be there with them, but the nurses are always there and doing the best we can. So yeah, look, it's scary for everyone, but yeah, this is something nurses have always done. We've always embraced these things. We've always risen to the challenge and been able to conquer whatever it is we have to.
And I'm sure the families feel very blessed to have you guys on side. So finally, what's the best part about being a nurse?
I think, so for me, I still love my job. I'm still passionate about being a nurse. Every day I go to work and it's something different. So for me, the best part is that you're always learning. So it's never the same thing day in, day out. So there's always something different. You're always learning new skills, always embracing the change, like COVID, for example, medications change, all of those things change. So you're always learning and adapting with that. But I think the best part for me is just the rewardingness of being a nurse, good and bad, that you're there to help people. You're there to make a difference in people's lives, and they will remember that, like I did when I was 10. I remember the nurses. You don't necessarily remember every patient you look after, but the better the experience that we can make for people's lives will last with them forever. So I think the ever-changing nature and the fact that we're there to make a difference to people.
Yeah, absolutely. And your faces are the faces that the patients really see the most. So
even under all our PPE,
they still recognise you. Absolutely. Yeah. Well, thank you so much, Michelle, for all of that. It really sounds like nursing is a stable and extremely rewarding career.
And so one other thing, Jodie, I think now more than ever, there's a huge demand for nurses. So I think the world has realised that we're here to stay. There's always a job for a nurse everywhere.
Absolutely. Yep. You're the superheroes of the world. Okay. So for more information, if anybody would like to have more information on any of the health portfolios at Bendigo TAFE, you can go through the website or call 13 TAFE. You can also apply directly through our virtual open day for the health and nursing course page. And thanks everyone for joining. Is there any questions, Alex? Thank you, Michelle, also.
I must say we have been bombarded by questions, so I hope you're both ready. We have a question from Eliza, who would like to know if Bendigo TAFE will help me with their placements. Also, what is it like at the moment in terms of placements?
I can help you with that one. That one's a question for me. So yes, that is actually my job. My job is to go out into industry for all health portfolios. I liaise with everybody. We source your placement for you, and placements can be many and varied. We do try to get you as close to home as possible. However, it's not always the case. And some facilities don't offer placement, like things like your mental health component, that can only be done through Bendigo Health. So we have a great relationship with Bendigo Health. You do get a lot of notice prior to your placement. So, there is preparation time, and I think it's always good to be prepared. You may need to travel and you may need to source accommodation, but accommodation is pretty cheap most places where you go, and it's reasonable. Some facilities offer accommodation, so that's something to be mindful as well. But yes, we do that for you. Placements for nursing other than aged care, which everything is closed statewide at the moment, but placements for nursing still go ahead. It's fine.
Beautiful. Thank you for that. The next question that we have is from Steph, and this might be one for you, Michelle. What's the difference between an enrolled nurse and a registered nurse?
Okay, so the difference is obviously an enrolled nurse is a TAFE qualified nurse, and a registered nurse is a nurse that's gone through the university sector. As for the differences, and a different time frame of the course as to how long the course actually goes for. The differences with the work, the registered nurse is able to do a few more skills that the enrolled nurses can't do. For example, in ICU, we only have registered nurses or intensive care nurses, but they're both able to work within all of the other areas within Bendigo Health. So yeah, the difference is those few little changes in the roles. Now, when you do the enrolled nurse course, it's the endorsed course, so you can give medications. So that's just changed in the last few years. So yeah, just a few different skill mixes.
Beautiful, thank you for that. And moving on to the next question we have is, what options do I have with a diploma of nursing in terms of working overseas? Is it a internationally recognised course? Does anyone know?
I can help a little bit. Michelle might have to dive in though and help me a bit with that. Only because I have family members that are nurses as well and they work overseas. So a huge portion of it is recognised, but you still have to register overseas, and there may be 1 or 2 units that you need to fulfil to get up to their standard. So although standards in Australia are very, very high, and some countries it's fine, other countries like Europe and Canada, there are things you need to pick up on.
And so the same in Australia, once you've finished your nursing qualifications, you have to register with a nursing body. So the same anywhere else in the world, you have to apply for a registration. But the good thing is that the body is the same wherever you are in the world. So even though there might be language barriers and things like that, we are all the same. So yeah, there is options to be able to work overseas.
Wonderful, thanks Michelle. And this next one I think is for you as well. And the question is, do I get to practice on real people before entering the workforce?
Well, it depends what you're practicing. So some things yes, some things no. So we have a wonderful lab set up with interactive mannequins at Bendigo TAFE. So things like venipuncture, so taking blood, we don't do that for the nursing course on our fellow students. We have mannequins that will allow us to do that on them. Taking ECGs, taking vital signs, blood pressure, pulse, heart rate, blood glucose levels, all of those things we do on each other. So we practice doing that on real people as well as the mannequins. So the lab time, even during these COVID times, you still get time to come into the labs and perfect those skills before you were actually to go out on placement. And as educators, we wouldn't allow you to go out until we knew that you were prepared and ready to actually do those things on real people. So yeah, it depends on the skills.
Fair enough, it seems to. The next question I think kind of correlates maybe back to the answer you had for the enrolled versus registered nurse. And this question is, do I need to attend university after TAFE, to be a nurse?
No. So after TAFE, you're a fully qualified diploma enrolled nurse. So you can go and practice once you're registered as an enrolled nurse. If you want to continue to become a registered nurse, then there's a bridging course that you could then go across to La Trobe, for example. But no, you can start practicing as a nurse after you've finished the 2-year course with the TAFE.
Fantastic. We're down to 2 questions. How exciting. The second last one is, are there many career options in nursing other than just being a nurse? And I anticipate that this maybe comes into your experience, Michelle, where you're an ICU nurse. I mean, what can they do other than just being a nurse?
So many different things. So you can work in a school and become a school nurse and help with mental health problems or just your usual school checks. You can go into public health and be a nurse at a community centre to help with education. You can work in rehab, mental health, aged care, community, so many different areas of nursing that you can actually work in. So it depends what your passion is and which way you actually want to go. So I've got so many friends that work in that many different areas, some that work in day surgeries and just do 9 to 5 hours, others that still do shift work like myself. So it really just depends which way you want to go. Either way, you're still a nurse, but yeah, just so many different areas of nursing that you can actually work in.
Can definitely be a benefit. Possibilities seem endless.
Mm.
We have another question, which is, I'm interested in both nursing and being a paramedic. Do they correlate at all?
Yeah, do you want me to keep going, Jodie? Yep.
Yeah.
Yeah, they do. So there's actually there's a Bendigo TAFE doesn't offer the paramedic course, so that is through La Trobe, but they do sort of correlate. What I would suggest personally and is going through the TAFE system, because once you've done that first 12 months, you can then go and work as a personal care attendant or a HSA, so that you can see which area actually suits you best. So not everyone is going to love every area of nursing. So working out which area is your passion. I could just guess off the top of my head, I know 10 nurses that I used to work with in ICU that have now gone into paramedicine, that are now paramedics within Bendigo. So it just depends, like if you want that adrenaline rush all the time of being a paramedic. So yeah, they do correlate. Some of the skills that you're learning are the same. So, your infection control, workplace health and safety, all your body systems and assessment and all of that would be similar. So yeah, it's just finding that area that you want to go into.
Fantastic. And I think the final question for this evening will be from Sophie, and she has asked, can a diploma of nursing get me to be an aid worker overseas, or would she have to continue through to uni to have that qualification? Bit of a tricky one.
So what do you mean?
Do you want me to read it again?
No, what does she mean by an aid worker? Sorry.
That's a fantastic idea. Sophie, if you can hear me, maybe do you want to perhaps pop in the chat again what you are looking for? Are you looking to be an aid worker in terms of like aged care, or
what does she mean, like an aid worker as in like a third world aid worker?
Look, I should put the call out to Sophie. If you're in the audience, if you could just, oh, here we go. She says medical say third world.
Yeah. Yeah, so I know this just from personal experience. So my sister has been to Africa 3 times. She's not a nurse. She's been to Africa 3 times with a Lions group or a Rotary group. And when they do that, they take nurses, doctors. My sister was just someone filling out the paperwork. So there's groups like that go every year and go and provide immunisations and medical care and wound care and a lot of education, as in infection control education and things like that, to people in third world countries. So yep, definitely there is options to do that. I've never personally done it myself. The thing with that, I think you're doing that, from the ones I've heard, out of the goodness of your heart, going and trying to make a difference in countries where they don't have those things available. But yes, definitely it is an option. It's not a registration thing. It's usually like more of a volunteer thing. I think is that what she means, do you think?
I hope so. And Sophie, if it's not, feel free to pop it in the chat if we have gotten that interpretation wrong. I'll do the final call out to anyone else in the audience. If you do have any final questions, please pop them either in the chat or the Q&A function. I'll hang off for maybe 30 seconds. And if there's nothing else, we'll close the webinar. Sophie said all good. So best of luck, Sophie. That sounds like a very exciting opportunity for you. And with no further questions coming through, I'd like to thank both Michelle and Jodie for a wonderful webinar this afternoon. It's been really informative, and I've definitely learned a lot myself about the nursing courses and opportunities that we have. So thank you to you both. Thank you to everyone who's in the audience at the moment, and we hope you continue to enjoy our virtual open day. We are online with the live chat until 8 p.m. So if you do have another question that comes to mind, feel free to jump on and our course experts will be able to help you. No further questions, and sounds good to call it, I think. So with that, good night, everyone, and thank you very much for joining.
Thank you.
Thank you.
Good night.